Hi everyone, I am Dr. Bala Chandra, Senior Consultant Neuro and Spine Surgeon, Yashoda Hospitals, High-Tech City. Nowadays, if you see, all the problems of the spine, maybe the neck pain, back pain, these problems are being seen in people of all age groups, maybe children. You don't get surprised if I say that I am seeing children as early as 12-13 years of age with severe back pain and neck pain. If you ask me, during our childhood and during 20 to 25 years before, these things were unknown in children until unless it was because of trauma, they fall somewhere while playing and all. But now it's not the thing. They are getting neck pain and back pain, and if you move little further in the age group of 20 to 40, which are active working group, these people are also getting neck pains and back pain as a very major complaint, which is affecting their life. They are not able to perform normally in their office activities or their occupation, and they're coming to us for help. The main reason is the change in lifestyle. If you see, there's no physical activity as a part of routine these days. So if you go for the children, the physical activity and physical sports, they have a decrease a lot. Most of the times, they spend time before the computers, laptops, mobiles, and the video games. So lack of the physical activity, along with the increased consumption of junk foods and the childhood obesity, is contributing to a large extent this spine problems. For example, let me say, with the junk food consumption and obesity, they will have less muscle strength, and the lack of physical activity adds to it, and it creates problems like back pain and neck pain even in children. And if you see the children now, they're watching mobiles, bending their heads for long, sitting in the same position for long, and all these factors are contributing to the back pain and neck pain even in children. If you go to the little younger population, like 20 to 40 years of age group, which is a working group, the same thing is happening. So there is no time for physical activity, and the activity which they are doing is most of the times a sitting job, which does not require any physical activity. And at the same time, the nutritional deficiencies in the sense, earlier days, if there is a nutritional deficiency and malnutrition, we used to imagine people who are very thin and didn't consume much. But nowadays, the malnutrition is different. It is excessive consumption of unnecessary nutrients causing obesity, and they lack the necessary nutrients which are required for the bone strength and the nerve strength. And excessive alcohol consumption and cigarette smoking and lack of physical activity, all these things are contributing to a large extent for these spine problems. And especially if you see the younger population, their stress is adding up, and then lack of physical activity is adding up. If you have a spine pain, the back pain or the neck pain, if you go to a doctor, they will definitely advise surgery. So with this misconception, they don't go to a doctor, they don't take opinion until unless the disease or the pain becomes very severe. In these back pains and the neck pains, most of the times, 99% of the times, you don't require any major interventions like surgeries, injections, or any procedures. It is simple advice towards a lifestyle modification and exercises, and medication for a few days will resolve these issues. First of all, first thing is you should notice that there is a problem, and you should consult a back physician, neurosurgeon, and a spine surgeon immediately, and then take a due advice. I promise you, and I tell you without any doubt, that surgery will not be advised without necessary, because definitely we do investigations depending on the clinical examination. If you listen to the history, and if you listen to the clinical complaints, and then after physical examination, we definitely order investigations, necessary investigations, maybe the MRI, maybe the X-rays, and depending on the severity, the advice will be given for the medication or rehabilitation or whatever. So in few cases, with severe extent of disease, like if it is causing troubles in movement, and if there is any weakness of the muscles, any nerve weakness, any grip weakness, any foot weakness, or any urinary complaints are there. So if the disease reaches to that severity, definitely we advise surgical procedures. And for those people also, we have advanced procedures like endoscopic spine surgeries, which we are doing these days without anesthesia, hernia without any cut, and they can be discharged on the same day or the next day. So why I'm telling all this is there is no need to be afraid of going to a spine surgeon or the neurosurgeon for these spine issues. You should consult whenever you have problem which is affecting your life, and take due advice and follow due precautions and due lifestyle adjustments. You will definitely get rid of these problems and lead a healthy life.
Like, comment, and subscribe for more health updates.